anyone with hay fever knows how uncomfortable it can be. So I'm joined by Kate Grieveson, who runs an aesthetic clinic which treats hay fever sufferers. Happy to have you with us. I mean, it's been pretty awful already, hasn't it? Why is the hay fever season with us so early on?
A lot of it is because of the increase in temperatures, and that increases the pollen production from trees, particularly oak and birch, and also the grass.
Okay, we're talking about this pollen bomb, and it sounds pretty horrific the minute you mentioned bomb. Can you just explain to us what it is exactly and what we can expect?
A pollen bomb is a spike in pollen, and again, it's mainly because of the increase in temperatures and also the fact that the pressure in the air is lower and the wind is less, which causes a concentration of pollen in certain areas.
And I guess the awful thing is, we just heard from our previous guest, he said we could be looking at really, really high temperatures, so presumably things can only get worse.
Yes, yeah, the high temperatures are definitely what contribute to the pollen for sure. Especially, like I said, the tree pollen and the grass pollen as well.
Okay, I just want to ask you something that I noticed. I mean, I never suffered from hay fever per se. You know, it's just a bit of a sniffy nose, but not like I do now. Is it a common thing for people as they get older to become more affected?
Yeah, it's one of those things where people don't really know exactly why that happens, but it is definitely a thing that as you get older, you can develop hay fever and other allergies. And some of that could be environmental, so people moving home and location, and also sometimes genetic as well.
Okay, we haven't got much time, but I wonder if you could just give us a bit of advice. So what is the best thing to do with these cases?
The most evidence is regarding prescription medications, antihistamines, things like fexofenadine. For people with severe hay fever, there are injections available. These aren't usually available on the NHS. This is Kenalog. You can also have nasal sprays and eye drops as well.
Well, I'm doing them all.